So the only vasoconstrictor for pediatrics is epinephrine. The dose for epinephrine is 0.01 milligrams per kilogram of a 1 to 10,000 concentration. You would give that rapidly either IV or IO, and then you would continue with your rhythm check and go ahead and if the patient is still in VFib, you can shock again. The next joules are 6 joules per kilogram. Once the 6 joules per kilogram has been delivered to the patient, you're going to continue CPR. Your next drug of choice is going to be your antidysrhythmic drug, and that drug is either amiodarone or lidocaine for pediatrics. You can use either one. Amiodarone's dosage is 5 milligrams per kilogram, and lidocaine's is 1 to 1.5 milligrams per kilogram. Again, as in adults, you just continue to repeat that cycle. So for kids, the maximum amount of joules that you can give is 10 joules per kilogram. So the next dose of joules would be 8 joules per kilogram. The one after that would be 10 joules per kilogram, and then you would stay with 10 joules per kilogram each time that you defibrillate the patient. As far as epinephrine, you can go ahead and continue epinephrine as often as within the cycle as many times as you need to. So again, you're going to shock epinephrine, shock amiodarone, shock epinephrine, shock amiodarone. But once you get to the 3rd dose of amiodarone, you do have to stop. So you can only give amiodarone 3 times before you have to stop using that drug. And then you would just continue with giving your epinephrine every 2 minutes during the CPR while shocking the patient.